Hi, Dr. Fauci.
Hi, Katie. How are you?
I'm good. Oh my God. I hope you get to take a vacation soon.
I don't think that's in the picture right now, but maybe.
One day,
Yep.
one day.
How
Have
are
you had
you?
any time off since this craziness
No,
started?
it is true. I don't advertise it because it seems almost hyperbolic, but I have not had a single day off in the last 27 months.
You must be exhausted.
I am quite tired.
Well, thank you for making time for us
Uh,
as always, Dr. Fauci. And can you just basically tell people watching this the state of affairs when it comes to the coronavirus right now?
Well, we are in an interesting phase right now because we are seeing a continuation in the diminution of new cases, hospitalizations, and deaths. Quite low. Yesterday, the deaths were within the 600s as opposed to, several months and months ago where it was, 3,000, 2,000 a day. One of the things that we have to keep an eye on, and the next few weeks I think are going to be critical. If you look at countries in Europe, they're all seeing a surge in cases. And the reason is the BA2 variant has become quite dominant throughout the world, and it's a bit more transmissible. Many countries, and I use the UK as sort of a prototype there because we generally follow them by a few weeks. They've opened up in the sense of no longer requiring masking in indoor settings, and they're having the same sort of waning immunity that we're seeing here, merely because, after several months, the vaccination effect tends to diminish. All of that is accounting for a surge in cases, fortunately, without necessarily a concomitant significant increase in hospitalizations. So we can expect over the next couple of weeks that we are going to see a surge in cases. Hopefully, there is enough background immunity, which would mean people who've already been vaccinated and boosted, as well as a lot of people who've been infected and recovered, so that even though there are new infections, that we won't see a significant increase in severity of disease with hospitalizations.
Well, I understand this BA2 variant, Dr. Fauci, is more contagious, but less serious than many people had with the first Omicron variant. Is that accurate?
No, not entirely, Katie. It is clear that we're seeing less severe disease compared to Delta, but there isn't much of a difference, plus or minus some variability, between the severity of the disease with BA1 versus BA2. They're about comparable, with that added issue that actually there are more people now, relatively speaking, who are getting BA2. So the dominance of the variant of BA2 is about 55% in this country. And it was only 10, 20, 30% just literally a couple of weeks ago.
Let's talk about Hong Kong, because it was pretty startling to read that more than 90% of all the deaths linked to the virus since the pandemic began happened in the last 30 days in Hong Kong. Is that an anomaly? What is happening there?
It is certainly an anomaly for a couple of reasons. First of all, the vaccine uptake there is not as good, as well as the fact that they use predominantly the Sinopharm and the Sinovac vaccine, which are Chinese-made vaccines, which with all due respect are not nearly as effective as the ones that are being used here in the United States. The overall efficacy is considerably less at every level, particularly when you think in the terms of hospitalizations and deaths. The other thing is if you combine below par vaccine effect with the fact that they've, particularly the Chinese in general, including Hong Kong, have very dramatically locked down to have a no COVID tolerance society. So the good news is that temporarily you don't see a lot of spread, but sooner or later, you have to open up, and you don't have a lot of background immunity. So when you open up, or when a new variant comes in, it explodes. And that's really what we're seeing there.
Let's talk about our preparedness, because I know you say we shouldn't be caught flat-footed. As more states relax restrictions and regulations, as vaccine and testing sites start to be dismantled, are you worried about sort of the pandemic infrastructure that has been set up? And are you concerned it may be too porous to handle another uptick, if not a surge?
We cannot let our guard down. We've continued to get people vaccinated who are not vaccinated. We've got to get people boosted who have not yet gotten boosted, even though they're eligible for a boost. It's very interesting that we have 65%, 67% of the total population fully vaccinated. About 75, 78% have received at least one dose. However, only about 50 to 60% of the people who were originally vaccinated and eligible for their boost have gotten their boost. And now we know that with the immunity that wanes over time, if we pull back and say it's all over and we don't continue to do the things that are important, like testing, like vaccinating, like boosting, and like getting people who do get infected to have the availability of drugs to treat the infection early on, which is why the new covid.gov website that the president announced yesterday is really very important, because it's a one-stop shop situation where you go online and you could locate the 2,000 sites that have test and treat, which means if you go in and you're positive, you immediately get treated right there. You don't wait. And that's really important, because the earlier you treat people, the better effect those antiviral drugs have.
Having said that, 65% of the population, Dr. Fauci, has been vaccinated. Is that a number we're just going to have to accept and live with at this point?
We're going to have to accept what is, and this is what it is. And it's really unfortunate that we've reached that point that there's such a pushback against a vaccine that is clearly highly effective and very safe. One of the things that we don't want to see is another wave or another variant, and then people will be falling behind, because by the time you get people vaccinated, it takes a few weeks to get the optimal response. You can get into some trouble. So you're right, we might have to accept that, but we shouldn't give up trying.
And what about the booster? I know that President Biden just got his. I'm eligible for mine. Should people over 50 get the booster ASAP? And what about people under 50?
The cutoff of 50 is somewhat of an empiric cutoff when you look at the data from the United States, but a lot of data from Israel indicates that when you get people above a certain age and you give them that fourth boost, you do, at least in the Israeli studies, and likely we will be seeing more information from the studies here in the United States, there is an advantage of preventing hospitalization and ultimately death. So I would say that even though it isn't a strong must recommendation, it's very clear that there is an advantage of that. If I take off my public health hat and put on my physician hat, I would recommend that if they were in that category, that they get vaccinated, particularly since the vaccines are so safe. It may turn out, and this is important, that on April the 6th, the advisory committee to the FDA, their VRBPAC, is going to meet to look at the long-range strategizing about where we're going with boosters as we get into the fall and before we get into the next winter. So it is quite conceivable, though I'm not jumping ahead of them, that they might actually recommend that by the time we get to the fall, that everybody should wind up getting a fourth boost. I don't know if that's going to be the case, but that's certainly conceivable.
When can children under 5 expect a vaccine? And what do you think has taken so long to approve that?
Right now, the reason we don't have that determination is that they're still collecting the data on that. It was thought that for children, this would be a 2-dose vaccine. And when the preliminary data came out, it was clear that it didn't meet the endpoint that we wanted it to meet. There was no doubt it was safe. So that's not an issue. The question is, what is the right dose and dose regimen to be used? Kids generally do well when they get infected, and the number of kids that get severe disease compared to an adult, particularly an elderly person, the numbers are very low, but still children can get severe disease. And that's the reason why we're getting the data that would underscore from a firm scientific standpoint why it's important to get the kids vaccinated.
Earlier this month, as you know, Florida became the first state to advise against vaccinating kids, citing low risk of infection among healthy children without underlying conditions. Are you concerned that more states will do the same thing?
Well, I hope they don't, because I think that was a big mistake. Children do get infected and they do get seriously ill, and not all of them have underlying conditions. So we've got to be careful about saying we don't want to vaccinate children when we vaccinate children for infections that are even less severe than this.
Is this going to be the new normal? Are we going to just see this particular virus continue to mutate and present itself in a new shape and form of various severity?
We don't know. I mean, I have to be perfectly frank and honest with you. We don't know. This virus is extraordinary. It's fooled us multiple times. Given its high degree of transmissibility and the fact that it is truly global, I mean, involving the entire world, there's no doubt that we're not going to be able to eradicate it. We've only eradicated one viral pathogen of importance, and that's smallpox. The next step is, will we eliminate it, like eliminate it from the country? That is very unlikely, given the transmissibility and the fact that we don't have a universal acceptance of vaccines the way we did with polio and with measles, which we have in fact eliminated from this country with few exceptions. So the best we can do is what I refer to as control, but make sure it's controlled at a very, very low level, so that it doesn't impact us the way it has impacted us over the last 2 years, where it really interferes with everything from economy to social interaction to a variety of other aspects of our lives. If we get it low enough and just not really causing any severity that is alarming any more than any other virus, that likely, which is where we would want to be. We'd want to eliminate it, but I don't think that's going to happen, Katie.
And what about Paxlovid? This is Pfizer's new antiviral pill. It's proven highly effective in keeping higher risk people out of the hospital.
Well, it's a very good drug. I mean, if given within the first 3 to 5 days of infection, it is about 89 to 90% effective in getting people to prevent them from going on to severe disease leading to hospitalizations and deaths. You know, we've contracted for a significant amount of it. We need to get more people, more physicians to realize that this is an important added benefit to patients who could actually do well, who might otherwise wind up in the hospital.